Welcome, Miss Karen.
Thank you so much, and thank you for having me.
Can you introduce yourself?
Okay, my name is Karen Tuke, like you've rightly said. I'm a provincial manager for Zimbabwe National Family Planning Council for the Midlands Province.
Okay, ndokumburawo kamwe nditiro overview yokuti Zimbabwe National Family Planning Council inoita nezvei kuitira kuti mumwe munhu asati ambonzwa nezvayo agozivawo.
Okay, so Zimbabwe National Family Planning Council is a parastatal under the Ministry of Health and Childcare, and we are mandated to provide technical expertise to both government and public facilities in terms of integrated family planning, HIV and AIDS, and adolescent sexual and reproductive health. We also do the branding of IEC materials that are targeted at family planning in adolescent health. And we are also coordinators of implementing partners. And these implementing partners are NGOs who are assisting government in offering services in the hard to reach areas. So we also coordinate service providers such as Population Services Zimbabwe and also Population Solutions for Health, amongst other stakeholders who are offering sexual reproductive health services in the province.
Okay, so nhasi tonyatsotaura nyaya yeSiana Press kuti iri kunyatsotambirwa sei in the Midlands Province since it was introduced recently.
All right, thank you. So Siana Press is a method that we introduced into the country in 2021. And subsequently in the province, we also then introduced it at facility level, where it was being offered by the service provider at the facility. So since 2021 till to this 2026, we've realized a gradual uptake in terms of Siana Press, like a new product. Usually when it gets into the market, people are skeptical. But as time has gone, we have realized that the uptake is also increased. So Siana Press is an injectable that is offered, can be offered at the facility or as self-care. So we initially rolled it as at facility based, where we wanted the clients to go and access from the service providers at the clinics. And then while this, we were also then educating the communities about the new product and also wanting at least to elevate its acceptance. But then in 2025, we then rolled it as self-care in the province, and we've noted a gradual increase in the number of people who are taking it as self-care. So by self-care, we're simply saying that a client can walk into the facility, get the first shot administered by the service provider, and they are taught how to then administer themselves at home. So it reduces client time of going to the clinic. It also reduces it in terms of cost for transport, and it also helps to increase in terms of expansion for in terms of options which women can have in the use of family planning. So you realize that some women whose jobs that do not allow them maybe to be moving around or even to get time to go and access services. But with self-care, they can then self-inject at home, it's in the comfort of their home or wherever they would be, that then increases in terms of method mix and also the uptake and also options for different women.
Okay, so what have been the feedback from the women who are using it?
Yeah, so yeah, we're getting positive feedback from women who have used it. Some are actually saying it's got lower side effects as compared to the other methods they've been using. And also some are very happy because you realize with Cenapres, it's a Uniject that contains a shorter needle, which is around 1 centimeter, as compared to our Depo, which got about 3.8 centimeters in terms of needle size. And also how it's administered. Cyan is just administered under the skin. So it's a subcutaneous injectable as compared to Depo, which is intramuscular. So I think Depo is got a bit of pain when you get it administered, and Cenapres causes less pain. So those are the kind of reviews we're getting from our clients. But all the same, we still have clients who have just stuck to the methods that they've been using previously. And then we have some who are also doing what you call method switch. They're moving from their methods that they were using to adopt Cenapres. And we're also having new users who are now just starting family planning and they've just started using Cenapres and they're loving it.
Oh, okay. So you are saying that Japana negative feedback or something?
So far we haven't received negative feedback amongst the clients that have adopted Cenapres.
Oh, okay. Ko ma-initiative ari kuitwa neZimbabwe National Family Planning Council kuita community engagement around Siana Press.
Okay. So what we've done in terms of community engagement, we've engaged at all levels. We are engaging service providers themselves. We've done mentorship programs where we have gone around throughout the province, targeted all facilities in the province, like each facility having one service provider coming to attend the mentorship processes so that they are able to administer and give more information on the product. We've also been reaching out to the communities through outreaches where we've been taking the product to the community, educating the communities through dialogues, and also offering the product even for free in those communities. We've also went on radio to popularize the product so that people have got information. We've also been using print media as well to disseminate information around Sayana Press.
So what have been the main challenges since its rollout in Midrand Province?
Okay, so I think with any other new product, there are always myths and misconceptions that surround, especially the use of family planning. So you'd realize that there are conceived untruths that people have when they hear of a new product. Some are skeptical to say you've brought this new product. We will ever continue to get this product, or young warrior is a once off and it's and then the next thing are consistent. So I think those are the kind of things that we've been dealing with. And also just the fear of starting maybe for women who would want to do self-care. Some are just not confident enough to administer it on their own, so we still have them going back to the facilities, which is not a challenge though, but in as much as we want it to be self-care, we still I think facing that kind of challenge where women are not yet comfortable or confident enough to administer it themselves. And then also naturally some people just fear injectables. So you'd realize that you still have to continue having clients who can be coming to the facilities. But I think the main problem will just be an issue of communication. So we are trying by all means to provide correct information out there so that we demystify the myths and misconceptions that are surrounding its use.
Okay, so what are your words kune vamwe vasingashandisi ningireni inonzi chii or vamwe vasitoshandisi ningireni family planning,
Okay.
especially the apostolic sect?
Oh, okay. So at the end of the day, family planning is your choice and it is also your right. It is your body and it is your responsibility. So we are saying we encourage women to use family planning because of its benefits. You realize that when we use family planning, we reduce unintended pregnancies, and by reducing unintended pregnancies, we're also reducing maternal deaths. We are also reducing unsafe abortions. So we would really encourage all women who would need to use family planning to find a method of choice which they would want and start using it.
Okay, that's all for today.
Thank you so much.